I chose to research prostate cancer because my dad was diagnosed with stage 4 prostate cancer when I was in 2nd grade. This means that the cancer that began in his prostate spread to nearby lymph nodes, which required additional treatment to get rid of the cancerous cells. I was young and it was all a little scary and confusing. My dad went through surgery and numerous rounds of radiation. 10 years later, he still has yearly checkups to ensure it hasn't returned or showed up elsewhere. Since I now know it runs in my family, I thought this was an excellent opportunity to learn more about it. To understand how cancer occurs, we need to look at the cell cycle. The cell cycle is a sequence of events that leads to the cell being split into two identical daughter cells. This cycle can be divided into two main phases, interphase and mitosis. Interphase is an active phase in the cell cycle with many processes occurring in the nucleus and cytoplasm to prepare it for mitosis. Mitosis is the process of division where the cell splits into two separate nuclei. Mitosis occurs in 4 phases: prophase, metaphase, anaphase, and telophase. Prophase is when the nucleus dissolves, the DNA supercoils, and the chromosomes condense. Metaphase is when the chromosomes line up along the middle of the cell and fibers from the centrioles attach to them. Anaphase is when the chromosomes separate and move to the opposite sides of the cell. And telophase is when the membranes form around each set of chromosomes and the chromosomes uncoil. Finally, cytokinesis occurs when the cytoplasm splits and two identical cells are formed. The main reason for mitosis is to keep the cell small. It wants to keep the cell small because it needs to keep the surface area to volume ratio as big as possible. A cell needs a large surface area to volume ratio to efficiently exchange materials across the cell. If the materials are not efficiently transferred across the cell would not have enough energy to run its processes. The proteins in each cell closely manage mitosis. If the proteins detect that there is damage to the DNA of a cell, and that damage is unfixable, the cell will go into a process called apoptosis, where the cell self-destruct so that the damaged DNA does not continue to be duplicated. If the proteins don't catch this mistake, and the cell continues to divide with the damaged DNA, this is how cancer is caused. Cancer is a disease where cells divide uncontrollably. When cells divide uncontrollably, they form a tumor, a massive tissue created when cells grow and divide too quickly. A tumor can be either benign or malignant. If a tumor is benign, it is not cancerous and does not invade other tissues. But if it is malignant, the tumor is cancerous and can spread into nearby tissues. This process is called metastasis and is when cells break away from the primary cancer and travel through their blood or lymph nodes to create a new tumor in a different part of the body. Now that we know the basics of cancer, let's talk about prostate cancer more precisely. Prostate cancer is the uncontrolled growth of cells in the prostate gland. The cause of prostate cancer is unknown, but some risk factors could make you more susceptible to getting this type of cancer, like age, race, family history, and the exposure to chemicals. Studies have shown that if someone closely related to you, like your father, has had prostate cancer, it more than doubles their children's risk of getting the disease. Given that cancer appears to run in some families, it suggests that there is possibly a genetic component. Inherited mutations of the BRCA1 or BRCA2 genes are linked to the development of hereditary prostate cancer. An environmental factor linked to prostate cancer is exposure to Agent Orange, which increases the risk of getting prostate cancer in more aggressive forms. There are no proven methods to prevent prostate cancer, but you can reduce your risk by eating healthily, maintaining a good weight, and exercising daily. 1 in 9 men will get prostate cancer in their lifetime. Also, 6 in 10 prostate cancer patients are 65 or older. Prostate cancer is rare in men under 40. The average age of diagnosis is 66, and prostate cancer is the second most common cancer in the United States. There are several ways to treat prostate cancer, such as active surveillance, surgery, and radiation therapy. To treat prostate cancer through active surveillance, you need to regularly watch the prostate cancer by performing prostate-specific antigen and digital rectum exam tests. To treat this cancer by surgery, a prostatectomy is performed where the surgeon removes the prostate. Finally, it can be treated by radiation therapy, which is the use of high-energy rays to kill cancer. Not everyone is as lucky as my dad, But if we can understand the cell cycle and how cancer is formed, we have a better chance of figuring out how to prevent cancer once and for all.